University of Florida health researchers have found a molecular pathway linked to triggering the deadly spread of the most lethal form of brain tumor. Their study findings may lead to physicians making better decisions regarding treatment and aid researchers in identifying a target for therapeutic drugs in about half of all patients diagnosed with glioblastoma. The results were published in the journal EMBO Molecular Medicine. According to collaborating researcher Florian Siebsen-Rubel, glioblastoma is the most deadly form of brain tumor and is also the most common form of the disease in adults. There is no available cure and the prognosis remains poor, mainly due to the fact that cancer cells can quickly invade the entire tissue of the brain. These tumor cells are also resistant to chemotherapy, so even if surgery and irradiation successfully treat the initial tumor, patients often suffer a recurrence of cancer shortly thereafter. Now researchers have discovered a molecular pathway known as the ZEB1 pathway that causes cells to leave the initial site of the tumor, creates resistance to chemotherapy in these cells, and leads to the generation of new tumors away from the initial site. In patients where this pathway is present, the progression of the disease is much worse when compared to patients where this pathway is not seen. These patients get sick rapidly, don't respond well to chemotherapy, and die sooner than others who lack the pathway. Siebsen-Rubel concludes, "This gives us an idea of what we can do to target these lethal cells. We also want to look at what is going on in patients where this pathway is not active.